Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by Jordan Shacker and colleagues, investigates the clinical and imaging characteristics of dogs exhibiting a condition known as nerve root signature in association with herniation of the intervertebral discs in their necks. Intervertebral disc herniation, often abbreviated as IVDH, is recognized as the most frequent disease affecting the spinal cord in our canine companions. While cervical or neck-related, IVDH accounts for roughly 15% of all IVDH cases in dogs, there has been a notable gap in our understanding regarding the specific clinical presentation of nerve root signature when it occurs alongside these cervical disc issues. Nerve root signature, or NRS, is a clinical syndrome that manifests as a dog holding up one of its front legs in a non-weight-bearing manner while standing. This peculiar posture is thought to be an indication of pain stemming from the entrapment or irritation of a spinal nerve or its root. While nerve root signature is most often observed in conjunction with intervertebral disc herniation and tumors involving nerve roots, it can also arise from various other underlying causes, including trauma, the formation of abnormal bony growths, inflammatory processes, degenerative conditions, and other types of growths. The precise mechanisms leading to nerve root signature remain unclear and are likely complex, potentially involving a combination of direct compression, inflammation, and a disruption of the blood supply to the sensitive nerve roots. In human medicine, a comparable condition known as cervical radiculopathy is well documented in individuals with cervical disc disease. These patients typically report pain that radiates along specific pathways related to the affected nerve root, often extending into the shoulder, arm, or fingers, particularly when disc material extrudes and impacts the 5th through 8th cervical nerve roots. A prior study focusing on human patients who underwent surgery for cervical radiculopathy found that almost all of them experienced arm pain, with the C6 and C7 nerve roots being the most commonly involved. Veterinarians generally agree that in dogs, cervical nerve root signature is most frequently associated with the involvement of nerve roots originating from the C6 to T2 spinal cord segments, which form part of the cervical enlargement and innervate the muscles of the front limb. However, the researchers in this study noted a lack of objective assessments of the clinical presentation in dogs with nerve root signature. Therefore, the primary objective of this study was to retrospectively analyze the clinical findings and magnetic resonance imaging, or MRI, characteristics of dogs presenting with nerve root signature that was confirmed to be associated with cervical intervertebral disc herniation. The researchers hypothesized that nerve root signature would be most common when disc herniations occur in the region of the cervical enlargement, but could also be observed with disease affecting the more cranial, or towards the head, parts of the cervical spine. Furthermore, they suspected that nerve root signature would be more likely when disc material protrudes or extrudes laterally within the vertebral canal or into the intervertebral foramen, thus compressing a nerve root. To conduct this investigation, the researchers meticulously reviewed the medical records of dogs admitted to the NC State Veterinary Hospital between January 2010 and June 2020. They searched for cases with a diagnosis of cervical intervertebral disc herniation that also exhibited clinical signs of nerve root signature. The presence of nerve root signature was determined either by direct observation during a physical examination or based on the owner's report of the dog holding a front limb in a flexed, non-weight-bearing position while standing. To ensure the focus remained solely on IVDH-related nerve root signature, dogs with any indication of orthopedic disease in the affected limb or other spinal pathologies besides IVDH identified on imaging were excluded. Cases involving specific types of disc herniations known as hydrated nucleus pulposus extrusion or acute non-compressive nucleus pulposus extrusion were also excluded, as were cases with incomplete medical records or diagnostic imaging. The researchers collected data on various factors, including the dog's age, breed, weight, sex, neuter status, and the duration of clinical signs, when available. For analytical purposes, dogs were categorized by age, with those 7 years or older considered older, and by size, with small breed dogs weighing 10 kilograms or less. The study ultimately included 47 client-owned dogs that presented with thoracic limb nerve root signature and MRI-confirmed cervical intervertebral disc herniation. The majority of these dogs were of chondrodystrophoid breeds, which are known to have a predisposition to intervertebral disc disease. Dachshunds were the most frequently represented breed in the study. A significant proportion of the dogs in the study were 7 years of age or older. When analyzing the MRI findings, the researchers focused on several key aspects: the location and laterality of the intervertebral disc herniation, the presence and severity of any compression of the spinal cord, and whether the herniated disc material involved the intervertebral foramen, the opening through which the nerve roots exit the spinal canal. The C6, C7 intervertebral disc space was found to be significantly overrepresented, accounting for nearly 1/3 of the affected discs. However, a substantial portion of cases involved disc sites from C2, C3 through C4, C5. Notably, the disc material was more often located on the sides or laterally compared to the middle or medially within the vertebral canal. Furthermore, the presence of disc material was significantly associated with compression of the nerve root at the level of the intervertebral foramen. Clinical signs of neck pain, also known as cervical hyperesthesia, were observed in all 47 dogs. Other neurological abnormalities noted during the clinical evaluation included incoordination or ataxia, intermittent lameness, weakness in all four limbs or tetraparesis, and in one severe case, complete paralysis of all four limbs or tetraplegia. Interestingly, in all cases, the side of the nerve root signature, whether it affected the right or left front leg, corresponded with the side of the lesion identified on the MRI. The magnetic resonance imaging was performed using either a 1.5 Tesla or a 3 Tesla scanner. Due to the retrospective nature of the study, the specific MRI sequences acquired varied somewhat among the dogs. However, all studies included T2, weighted transverse and sagittal sequences, which are crucial for visualizing fluid and soft tissues. The analysis of the MRI scans revealed that the site of disc herniation was in the cranial cervical region, involving the C2, C3, C3, C4, or C4, C5 disc spaces in a little over 40% of the dogs, and in the caudal, or towards the tail, cervical region involving the C5, C6, C6, C7, or C7, T1 disc spaces in the remaining majority of dogs. While there was no overall significant difference in the number of cases between these two broad locations along the cervical spine, when each specific disc space was examined, the C6, C7 site was significantly overrepresented compared to all other disc sites. The agreement between the two independent reviewers who evaluated the MRI studies was good for several key variables, including the presence and severity of spinal cord compression, the presence of foraminal involvement, and the location of disc material within the foramen. Moderate agreement was found for the laterality of the disc material and the degree of foraminal compression. Evidence of spinal cord or the compression of the subarachnoid space, the fluid-filled space surrounding the spinal cord, was observed in the vast majority of dogs. For those with spinal cord compression, it was most commonly classified as mild. Spinal cord signal changes, such as increased intensity on T2, weighted images suggestive of inflammation or fluid accumulation, were noted in a small number of cases. The side of the disc herniation was nearly equally distributed between the left and right sides. However, a statistically significant finding was that the herniated disc material was almost 3 times more likely to be located laterally within the vertebral canal compared to medially. Furthermore, the study found that dogs with nerve root signature were twice as likely to have disc material compressing the nerve at the level of the intervertebral foramen compared to those without observable foraminal compression. In cases where foraminal compression was present, it most often involved the proximal, or closer to the spinal cord, portion of the nerve root. A high degree of foraminal compression, indicating a greater than 50% reduction in the height of the foramen, was also frequently identified. Interestingly, in the approximately 1/3 of dogs where no foraminal nerve root compression was evident, the disc herniation was more often located in the medial quadrant of the spinal canal. In a minority of cases, dogs had evidence of intervertebral disc herniation at other locations along the cervical spine. However, based on the reviewer's consensus regarding the degree of compression and the likely chronicity of these other lesions, these were not considered the primary cause of the nerve root signature. The findings of this study provide valuable insights into the characteristics of nerve root signature associated with cervical intervertebral disc herniation in dogs. The confirmation that nerve root signature is more prevalent with disease in the caudal cervical spine, particularly at the C6, C7 intervertebral disc site, compared to other locations, is a key observation. This suggests that there might be unique anatomical features at this level that predispose to the development of nerve root signature when a disc herniation occurs. However, the study also importantly demonstrates that nerve root signature can indeed be a clinical manifestation of intervertebral disc herniation occurring anywhere along the cervical spine. Over 40% of the dogs in this study had disc disease at the more cranial intervertebral disc sites of C2, C3, C3, C4, or C4, C5. This is notable because the nerves exiting at these levels, the third through fifth cervical nerves, do not directly contribute to the innervation of the main muscles of the thoracic limb in most animals. Finally, the research highlights that dogs with nerve root signature are more likely to have herniated disc material that is positioned laterally in the spinal canal or that compromises the intervertebral foramen. Nerve root signature is generally thought to arise from the compression or inflammation of neural tissue, and it is often described as being related to the involvement of the nerve root rather than the spinal cord itself, specifically those nerve roots that contribute to the innervation of the limbs. Nerve roots are the initial segments of spinal nerves as they emerge from the spinal cord. They are particularly vulnerable to injury due to their location within the rigid confines of the vertebral canal and intervertebral foramen, which offers limited space to accommodate mechanical forces and makes them susceptible to compression. The clinical presentation of nerve root signature is believed to reflect a sharp or shooting pain that travels down the limb, leading affected animals to adopt a flex limb posture in an attempt to alleviate this discomfort. In human patients with cervical radiculopathy, it has been noted that raising the affected arm above the head can help reduce the pain, a finding that can aid in diagnosis. However, the observation in this study that nerve root signature can occur with disease affecting cranial cervical intervertebral disc sites and their associated nerves suggests that this phenomenon is not solely dependent on the involvement of nerve roots that directly innervate the limb musculature. Interestingly, similar findings have been reported in other studies. One report on lateral and within foramen cervical disc extrusions in dogs described referred pain to a thoracic limb as a clinical sign in several cases, including some with involvement of the C3, C4 intervertebral disc site. The authors of that report attributed nerve root signature to the entrapment of a nerve root that contributes to the innervation of the shoulder or extremity, specifying the C4 through T2 nerve roots. However, it's important to note that early anatomical studies typically did not consider the C4 nerve root as part of the brachial plexus, the network of nerves supplying the forelimb. Another study involving dogs with cervical intervertebral foraminal disc extrusion found that a high proportion exhibited signs consistent with nerve root signature, with one case involving the C4, C5 intervertebral disc space. It is possible that in animals, the manifestation of nerve root signature might be more related to the quality of the pain experienced, such as a shooting or stabbing sensation perceived anywhere along the neck, rather than the precise origin of the pain. Such sensations might prompt the animal to lift a limb in an instinctive attempt to reduce pressure on affected nerve roots. Alternatively, intervertebral disc herniation could trigger a localized inflammatory response that affects adjacent nerve roots. Experimental studies have indeed demonstrated that extruded nucleus pulposus, the soft inner material of the disc, can induce an inflammatory reaction independent of direct compression, which can lead to nerve root dysfunction. There has even been a reported case of a dog with lumbar nerve root compression that presented with nerve root signature in the opposite limb, suggesting that the clinical presentation can be quite variable. However, this was an isolated case, and no instances of nerve root signature affecting the limb opposite to the side of the lesion were observed in the current study. Lateral disc herniations would logically be more likely to affect the nerve roots as they emerge from the spinal cord and vertebral canal, either through direct compression or by inducing adjacent inflammation. The findings of this study support the idea that disease associated with the nerve root is more prone to result in nerve root signature. However, it is noteworthy that approximately one-third of the dogs in this study showed no evidence of foraminal impingement on MRI. In these cases, the disc herniation was more frequently located in the medial quadrant of the vertebral canal. It is possible that in these situations, nerve root signature could be associated with more proximal compression or irritation of the nerve root within the spinal canal itself before it reaches the foramen, or it could be due to a localized inflammatory response. The apparent preference for nerve root signature in the caudal cervical spine might be due to an increased likelihood of lateralized disc disease at these more caudal levels, possibly related to inherent structural and anatomical characteristics. The C6, C7 disc site was the most commonly associated with nerve root signature in this study, followed by C5, C6. This pattern differs from the general site predilection for Hansen's type I cervical intervertebral disc herniation in dogs, which is typically most common at C2, C3, with the frequency of involvement gradually decreasing from C3, C4 to C7, T1. This caudal cervical preference observed in this study aligns with findings from studies investigating cervical radiculopathy in humans, as well as foraminal intervertebral disc extrusion in dogs. Additionally, foraminal stenosis, or narrowing of the intervertebral foramen, associated with cervical spondylomyelopathy, another condition affecting the cervical spine, is also more common in the caudal cervical region. In humans, the height of the cervical intervertebral foramina decreases as you move caudally down the spine, with the smallest measurements typically found at the C5, C6, and C6, C7 intervertebral disc spaces. Furthermore, a correlation has been observed between narrower disc spaces and smaller intervertebral foramina. A similar caudal decrease in the height of the intervertebral foramina has been reported in Doberman pinschers, a breed known to be susceptible to foraminal stenosis, with a high incidence of this condition identified in both clinically normal and affected dogs, and the C6, C7 site being the most commonly affected by both disc degeneration and foraminal stenosis. This relative narrowing of the foramina in the caudal cervical spine could potentially make the nerve roots in this area more susceptible to a greater degree of compression in the presence of space-occupying disease, such as intervertebral disc herniation, thus leading to a higher incidence of nerve root signature at these caudal locations. Collapse of the intervertebral disc space is a common finding in both humans and animals in association with the extrusion or protrusion of disc material in intervertebral disc herniation. Besides directly reducing the width of the disc itself, intervertebral disc herniation also contributes to the narrowing of the intervertebral foramina adjacent to the affected disc sites. This disc space collapse and the resulting foraminal narrowing can cause compression or irritation of the nerve roots as they exit the intervertebral foramen. Disc space collapse is a recognized frequent cause of cervical radiculopathy in humans. Therefore, the combination of disc space collapse and a greater degree of pre-existing intervertebral foraminal stenosis could predispose dogs to develop radiculopathy with intervertebral disc herniation located at the more caudal sites in the cervical spine, potentially explaining the higher incidence of nerve root signature observed there. However, disc space collapse was not a specific variable measured in the study, so the direct relationship between this and nerve root signature could not be evaluated. This study did not attempt to specifically differentiate between dogs with disc protrusions, where the disc bulges, and disc extrusions, where the inner material leaks out, as surgical confirmation was not a requirement for inclusion. Studies on large breed dogs with intervertebral disc herniation in the thoracolumbar region, the mid to lower back, have identified imaging characteristics that can help distinguish between extrusions and protrusions, including the laterality of the disc material, the extent of intervertebral disc degeneration, involvement of a single versus multiple disc sites, and the spread of disc material beyond the normal boundaries of the disc space. Of these criteria, only the laterality of the disc material was assessed in the current study, which showed that dogs with nerve root signature were significantly more likely to have disc material located laterally within the spinal canal. Although specific criteria for differentiating cervical disc extrusions from protrusions in dogs have not been thoroughly evaluated, if the criteria established for the thoracolumbar region are applicable to the cervical spine, this finding might suggest that the majority of dogs in this study had disc extrusions. The large number of chondrodystrophoid breeds in the study sample, a group known to be more prone to disc extrusions, further supports this possibility. The study population was approximately equally divided by weight into small and large breed dogs. This categorization was done to explore whether nerve root signature was more common in small breeds, which are known to have a higher predisposition to disc extrusion. Furthermore, about one-third of the dogs were of breeds not typically considered chondrodystrophoid. Therefore, while nerve root signature seems to occur more frequently with disc extrusions, it is also possible that it can be seen with disc protrusions, perhaps due to chemical irritation of the local nerve roots rather than solely mechanical compression. A study involving surgical confirmation of the type of disc herniation would be necessary to more accurately determine the likelihood of nerve root signature associated with cervical disc extrusions versus protrusions. A significant majority of the dogs presenting with nerve root signature in this study were over 7 years of age. Although intervertebral disc herniation in chondrodystrophoid breeds typically peaks between 3 and 7 years of age, cervical disc disease tends to affect older dogs. As dogs age, the prevalence of disc degeneration increases, leading to a higher chance of disc collapse along the cervical spine. This increased prevalence of disc collapse could potentially put older dogs at a greater risk for developing nerve root signature compared to younger dogs. However, a statistically significant relationship between age and the presence of nerve root signature was not identified in this specific study, and further research with a larger sample size would be needed to investigate this further. An important finding was that approximately one-third of the dogs with nerve root signature in this study did not show any evidence of foraminal nerve root involvement on MRI, even though lateralized disc disease was significantly more common than midline compression. This suggests that nerve root compression at any location, including within the spinal canal before the nerve exits the foramen, could be sufficient to cause nerve root signature. However, The researchers also acknowledge the possibility that observers might have underestimated the presence of foraminal nerve root compression due to the positioning of the MRI slices. To accurately assess foraminal nerve root compression, the MRI slices need to be precisely aligned along the disc site and oriented at an appropriate angle relative to the disc and intervertebral foramen. As the imaging in this retrospective study was not performed specifically to evaluate the foramina, the position and angle of the images varied among cases. Some MRI slices might not have been perfectly aligned or angled, potentially leading to an underestimation of foraminal involvement. Additionally, the standard MRI protocols used, while comprehensive for general spinal cord evaluation, might not have been optimized for detailed assessment of nerve root compression and foraminal stenosis. The researchers suggest that future studies could consider incorporating additional MRI sequences, such as gradient echo images with magnetization transfer, angled sagittal views, and dynamic MRI sequences, to potentially provide better visualization and assessment of the intervertebral foramina and nerve roots. The study has several limitations, primarily stemming from its retrospective design. There was a lack of standardized imaging protocols and consistency in the timing of imaging relative to the progression of the disease. Some dogs with nerve root signature were not imaged until their clinical signs had worsened, which could have resulted in further disc extrusion in the meantime. The imaging protocols were designed for a general evaluation of the cervical spine and spinal cord and were not specifically tailored to focus on the intervertebral foramina. Therefore, the extent of foraminal involvement might have been underestimated depending on the specific slices included or the angle at which they were obtained. Furthermore, all MRI sequences were acquired with the neck in a static extended position, and any dynamic compression that might occur with neck movement was not captured. Neck extension is known to decrease foraminal width in humans, which could potentially lead to an overestimation of foraminal compression in the dogs in this study. Although all included dogs had confirmed intervertebral disc herniation, a small number also presented with other abnormalities, such as disc disease at other sites, spinal cord compression not directly related to the primary lesion, syringomyelia, fluid-filled cavities in the spinal cord, and changes within the spinal cord tissue itself. While these were uncommon, the possibility that they contributed to the development of nerve root signature in those specific cases cannot be entirely ruled out. These cases were included in the analysis, as they represent the real-world clinical presentations encountered. Finally, although the reviewers were blinded to the specific clinical details of each case, they were aware of the overall aims of the study, which might have subtly influenced their evaluation of the degree of compression. In conclusion, this study has provided valuable insights into the clinical and imaging characteristics of nerve root signature associated with cervical intervertebral disc herniation in dogs. It has demonstrated that nerve root signature can occur in conjunction with intervertebral disc herniation at any disc site within the cervical spine, although it is significantly more prevalent with involvement of the more caudal cervical disc sites, particularly C6, C7. Additionally, the study has shown that nerve root signature is more frequently associated with lateral disc herniations and those that result in compression of the intervertebral foramen, but it can also be present even when these specific imaging findings are not clearly apparent. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.